Okay, so we are going to be palpating the knee, and what we have here is the patella, which is the most noticeable part of the knee, and we'll just start with that. We are going to move just inferior, and right here we have the patellar tendon, and if we move a little bit more inferior, about here, then we have, we get to a bony prominence, the tibia tubercle. This is where the patellar tendon inserts. If we were to move just laterally, right here, this is where we have Gertie's tubercle. And if we were to go medially, over here we have the medial tibia, where the tendons of the pes anserine are going to attach. So I'm just going to have you flex your knee just a bit. There you go. Again, we're going to start with the patella right here. And then medially, we're going to drop off into this empty space where we see our medial joint line right along here. If we continue to go medially, going to, as you feel the thickening, it's going to be the MCL, or the medial collateral ligament. And then just superior to that, you'll reach the large bony prominence here, and that is the medial epicondyle. Moving just superior to that and somewhat deeper, right about here, we're going to feel just a small protrusion, the adductor tubercle, which is where the adductor magnus attaches. So we'll just go back to the patella and do the lateral side. So right off the patella, come into this drop, and that is the lateral joint space. Goes right along here. Moving more laterally, we'll reach this cord-like tendon, and that's your LCL, or your lateral collateral ligament. Move superiorly right here, and the bony protrusion is the lateral epicondyle. This is where you also start your goniometer. And then if we went just inferior to that, we're going to hit this knob-like protrusion, and that is the head of your fibula. Okay, starting back at the patella, some of the contractile pieces, landmarks that we have. If you just go superior to that, you're going to hit your quadriceps tendon, and then I'm going to have you straighten your leg out just a little bit. And so here's your quadriceps tendon here in this, just above the patella. And then can you flex your quads? Okay. And so to the medial side, you have the vastus medialis tendon, and just above that, you're on the vastus medialis. Moving medially, you have the cylinder-like muscle, which is the rectus femoris, and then moving more laterally, you're going to hit the vastus lateralis. And then if you continued laterally, almost to like the entire furthest lateral you can go, you have this broad band, which is your IT band. I think that's all for there. Well, if we went all the way down the lateral side. You're going to hit the lateral malleolus, and then all the way across your ankle, and you have your medial malleolus. So I'm just going to have you flip over to your stomach. Okay. And how do you flex your leg up just a bit? Yeah, that's good. Okay. Okay, so on the lateral portion, very obviously, you have the biceps femoris tendon, and then just there, your biceps femoris, and then into the popliteal fossa, and just a bit more medially, you're going to hit the semitendinosus tendon, and then just a bit more medially and deep, you have your semimembranosus tendon. So you can go ahead and relax. And I believe we hit all the pieces that we needed to. So all good.